Okay, well, welcome again to the Board of Health and Hospitals meeting. Um, again, I just before we started, I was saying it's been a very eventful series of days for us, for this country. And despite all the things that we've witnessed, I remain resolute in the direction this country is taking, the durability of the Constitution. And I believe that there are others who, irrespective of their positions, who will do the right thing because that is, though we really have a deep tradition in this country, and it came to play in the middle of night. Um, this rather in the middle of the morning this morning. So. My heart is heavy. I'm aware that there were several deaths, including the young woman we heard about. I heard that there were three or four others. And we, in public health, um, believe that the health of all of us are, are important, and our policies should support the health of all individuals, all communities. So our heart goes out to those. As we direct our attention to what we're doing here locally, I think we're going to start this new year on a very good foot. Um, Lots of things to plan. As this is going to be a very busy meeting as we prepare for this 2021 year. Before we get started, I want to review the recordings. We'll actually have you review you've actually reviewed the recordings. I would entertain a motion to approve the recordings of our last meeting in lieu of the minutes for the Board of Health. Is there a motion?
I motion that we approve the minutes.
Is there a second?
Second.
Okay, moved in second. All in favor, please signify by saying aye.
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 Any
Aye.
opposed? Okay, any abstentions? Okay, the minutes are approved. So I'm pleased to see the growth and the expansion of the board, particularly at this time period when we actually have this renewed focus on improving the health of the St. Louis region, and new voices are always important to that. This is obviously a very important transition year. This is my final meeting as board chair. After 7 years, actually is now going into 8 years, 8-year stint as a board chair, and 12 total years on the board. I have 2 more years on the board, and I will serve faithfully after being appointed by Mayor Cruson last year. And so I'm really pleased to step down and turn over the leadership to the capable hands of Dr. Rhonda Ballou, and who will serve as chair, and Timothy Mcbride, who will serve as vice chair. We couldn't be better positioned. I think many of us know Rhonda quite well. She's the current chair of the Department of Health Management and Policy at St. Louis University's College of Public Health, Social Justice. She's considered one of the top leaders in public health in the region, if not the country. Her research has really laid bare the roots, the genesis of social and structural determinants of health. She has active research ongoing in that area. I've had a chance to review that, and I think that she's clearly on the forefront of change with her work, as well as her remarkable civic duties, which are myriad. No, and not a lot of time to discuss those, but they are indeed myriad, which is why she received a fitting award from the St. Louis American newspaper last year. We're also proud that Tim McBride has agreed to remain as vice chair of the board. Tim has some remarkable policy chops, as we know, both nationally and locally and statewide, particularly in the realm of the Medicaid policy in his previous role. Tim is a Bernard Becker professor in the school in the Brown School of Social Work and co-director of the Center for Health Economics and Policy at the Institute for Public Health. These two are time and trusted leaders, widely respected in their fields. And so I really feel comfortable that we're in a good position going forward. And I'm happy to turn over the helm to Rhonda as chair and Tim as vice chair. And so with that being said, I do that, and I will now allow Rhonda to make a few statements. So thank you all.
Thank you for that introduction, Dr. Ross. Very, very kind. I really appreciate it. And thank you for all of the work that you have done to see us through the pandemic during 2020. I know it was a tremendous amount of work, and thank you for your leadership for the past 7 years. You have given me some big shoes to fill, and have really set us up nicely to continue moving forward to serve the citizens of St. Louis City and the region. So thank you. And again, I'm honored to serve in this capacity, and I look forward to working with the board and Dr. Eccles and all of the St. Louis community. So thank you very much. We have, and thank you also, Tim, Dr. Mcbride, for serving as vice chair. And I greatly appreciate the camaraderie, and am grateful for all of the assistance and support that I can get. And I've enjoyed, even in the past several weeks over the holidays, we've had a couple of chats and conversations, Dr. Ross and Mcbride and Eccles, to make sure that we're prepared to start the year to hit the ground running, because we still are in the midst of a pandemic, and we have a lot of work to do to protect the citizens of this region. So I just thank you, Dr. Ross. I mean, when I say I have big shoes to fill, Dr. Ross has been a really phenomenal, outstanding leader, not just on the board, but in the city of St. Louis and Washington University and nationally. We'd have to have an entire meeting to list all of the things that Dr. Ross has accomplished. And so I'm honored to be able to follow after him. So again, I look forward to working with all of you to promote and protect the health of our region. So on that note, I know we have an agenda, and our next agenda item is a COVID update from Dr. Eccles.
Thank you, Dr. Ballou, and welcome as you walk into your new role as the chair of the Board of Health. We're really excited about the opportunity to work more closely with you in this capacity. As everyone knows, so first I'll cover the data. So over the last 2 weeks, because of the holidays, testing resources really dwindled in the city of St. Louis and the St. Louis region. So the testing volume actually decreased. And so with that, we had fewer cases that were reported over that time period. And we also had, however, the percent positivity essentially remained about the same, around 15%. However, this week, testing resources have increased, and we've seen an increase in testing volume across the city and the St. Louis region. With that, we've had more cases reported, and our percent positivity has increased by 1.4% to 17. So this is something we're really looking closely at. And we are although the federally qualified health centers have provided the majority of the testing resources in the city of St. Louis, we are looking to increase capacity to make sure that even after the vaccine is distributed amongst the general population, that we can still maintain the testing capacity that's needed to identify cases, investigate cases in a timely manner, and slow the spread of COVID-19 in our jurisdiction. With that said, the population that continues to have the highest number of newly reported cases continues to be those individuals from age 20 to 39. So again, we're still working closely to really focus on that group to more effectively reach that group so that behavior change can spread across that particular demographic in our city and the region. So we're having ongoing discussions with our media partners, with STL TV and other partners across the region to make sure that we're getting the information out as best we can to as many people as we can. We're also using additional resources such as Notify STL and other platforms that are available through the city of St. Louis to make sure, again, we're reaching individuals, as many individuals as possible, and reminding them of the COVID-19 restrictions that are in place in the city of St. Louis. For vaccine distribution, to date, the federally qualified health centers and the City of St. Louis Department of Health have not received COVID-19 vaccine. All the vaccines for the city have been allocated to, at least previously have been allocated to the hospital systems to make sure frontline workers could receive the vaccine. A second allocation was also given to pharmacies that were providing services or administering the vaccine for long-term care facilities. So back in November of 2020, the state's office sent a notification to the long-term care facilities across the state, notifying them of the opportunity to receive vaccine through national pharmacies such as Joel Osco, CVS, Walgreens, et cetera. And so the majority of them actually opted to enroll in that program. In the city of St. Louis this week, we actually called did a cold call to all of the facilities to just check the status of their application to make sure they were enrolled. And based on the ones that we were actually able to talk to, over 50% of the long-term care facilities and congregate living facilities in the city of St. Louis enrolled in that program. However, they have not received their first allocation, their first dosage of vaccines, but they are in queue to receive the vaccine. So I think right now the biggest challenge with vaccine distribution is just the supply. The supply is insufficient to meet the demand of even the healthcare workers. And so we're working really closely with the state and our local partners and participating in national discussions regarding the COVID-19 vaccine. And so as more information is received, we make sure that we get that information out. The health department did stand up a COVID-19 vaccines website. On this website, we include information about the priorities as well as some general information regarding some of the answers to some of the more common questions that are being raised across the communities, so that individuals will have answers to those questions. And as information becomes available, we'll update that FAQ to make sure it reflects the most current information that has been published by the federal government and the state. The other question that has been raised around COVID-19 is return to schools. So based on the information that we have in the city of St. Louis, school age youth, being those who are aged 5 to 17, account for roughly 5.6%. And so that's the total number of cases. That's been really consistent over the last few months. At the beginning prior to schools resuming session, the health department worked really closely with the mayor's office and all of the school systems in the city of St. Louis to make sure that every school had an operating plan, infection control plan in place that was tailored to their particular institution. Over the course of the last few months, we've also taken additional steps to make sure that we had disease investigators assigned to the school system, so that they had someone that they could talk to in the event that they had a situation arise that they didn't know how to navigate. And so we've been working really closely with all the school systems over the last few months. And because of the diligent work that they've done, there's no evidence, at least in this St. Louis public schools, there's no evidence of transmission occurring in the schools. The issue that we've had in St. Louis public schools, along with other school systems, is not the children, it's been the adults. So a lot of times schools had to modify their operations because the adults, being the staff, were engaging in activities that increased their risk for COVID-19, being exposed to SARS-CoV-2, and then subsequently getting infected with COVID-19, being diagnosed with COVID-19. So we are continuing to urge all adults to really do the right thing because their behavior is really dictating what happens in the schools. And so we really, in order for schools to resume in-person learning and to be able to continue in-person learning, we need them to adhere to the restrictions that have been set forth for the city of St. Louis. In addition to that, so as we look at their infection control plans, all the plans that have been adopted go beyond just COVID-19 because we wanted to make sure that we didn't develop tunnel vision and solely focus on COVID-19. There are other respiratory illnesses and there are other communicable diseases that impact the health of youth. And so we wanted to make sure that they had a comprehensive plan that allowed them to know, what steps need to be what steps they need to take to make sure that that information is properly reported to the city of St. Louis. And then there's also steps that they can do within the organization, within the institution, to mitigate the spread of communicable diseases, whether it's those that are transmitted by respiratory transmission, foodborne, or waterborne illnesses. And so those plans are already in place. And again, we've been working really closely with all the school systems across the city of St. Louis, and we'll continue to do that even through the upcoming year, because we know that just because the vaccine is available doesn't mean that we have the freedom, if you will, to discontinue those other preventive measures that are in place, because the vaccine alone is not a panacea. So we have, similar to what we do with the flu vaccine, during flu season, the vaccine is great, but we also have to continue to make sure we're implementing those preventive measures to slow the spread of COVID-19 and other illnesses that are transmitted by respiratory transmission.
Thank you, Dr. Eccles. Are there any questions or comments? Dr. McBride?
Yeah, thanks, Dr. Eccles, for your report on the vaccines. That's really helpful. As I understand your report, we're following the CDC guidelines in the state, is that right? And we're, as I sort of followed what you were saying, we're still in phase 1A, is that right? And so you as the city don't have access to the vaccines yet beyond, because they're in the long-term care facilities and with healthcare workers. Do you have a sense of when we'll move into phase 1B?
So when we move to from phase to phase, that will be dictated by the state. So we're following the state's lead. We did receive information yesterday that the city, along with the federal qualified health centers, should receive the first allocation of COVID-19 vaccine, which will likely be Pfizer within the next 7 to 10 business days, so roughly 2 weeks.
Okay, that's helpful. And when I look at the CDC website, which I been doing every day, as you probably know, it looks like the state, as I looked at the numbers this morning, according to the CDC website, the state's been distributed about 300,000 vaccines, but initiated about 105,000, which is about 35%. Do you have an understanding of what those numbers are? But I know they're not in your control, but can you help me understand those numbers?
I think the 105 administered vaccines probably just the percentage of the number of individuals that have received their first dose. Some have received their second dose. So that varies. That is varied from agency to agency, even within the city of St. Louis, amongst the St. Louis Metropolitan Pandemic Task Force hospitals. The percent coverage of first line or frontline workers ranges from roughly 45 to 65%. So there's a great the differences between hospitals as far as the uptake of the vaccine. And so, and then we also have to look at different regions. So different jurisdictions have different capacities And so some of the smaller, more rural areas may not have as many frontline healthcare workers. And so some of them have actually completed vaccinations for their those included in 1A. And so one of the questions that they raised to the state was, are they able to move to 1B? And the state said no. And so what may happen is the state may have to repurpose some of those vaccines, but that remains to be seen. We're still waiting on additional guidance from the state regarding how they want to handle that situation. But I do know that the state wants everyone to move from one phase to the next at the same time to make sure we're kind of having, I guess, somewhat operating at the same cadence.
Thank you. That's helpful.
I have a couple of questions, Fred. First, regarding the school openings. Now, I understand that the schools are tentatively prepared to open on next Monday. And I certainly understand what you're saying about the 5.5% rate, relatively low. Nonetheless, as we look at school openings, we're asking that they adhere to the guidelines of distancing of desks within schools, limiting the capacity of classrooms. Some schools have the ability to do that because they're smaller schools. Some schools don't. And they're going to have to make some decisions about reducing the number of students in the facility, which puts those students at a disadvantage in terms of being in a learning center after being out for so long. So in terms of having an equitable response to this, so that all schools can have the resources to open. I don't have the answer here. I'm asking for your input on what can we do? What can we recommend? I know you've had conversations with Superintendent Kelvin Adams on this matter. It's a difficult one. There's a lot of apprehension right now among school teachers because this is not clear, and there's we haven't had a time period which allows policies to be enacted and shared across the school systems.
So that's a great question. So that was at the forefront of planning back in the summer of 2020. And so when we developed a template for the infection control and operating plans for schools, it was just that it was a template. So we worked with them to tailor their plan to fit the mold of their school. So they know what their capacity is, they know what resources they have, and know what their infrastructure is like and what challenges they may experience while implementing different protocols. And so each plan is tailored to the school. So we made sure that was, because that was a huge concern of mine, because different schools have different capacities and so forth. And so we made sure that was addressed early on. So every plan that's in place is tailored to the school.
Appreciate that. Okay, that needs to be conveyed because again, there's a sense that there's people, the wider public, I don't think really understands the amount of planning, the thought that went into that planning. Thanks, Fred. The second question really is regarding this, this new variant, the new SARS-CoV variant, which conveys a higher level of transmissibility. It's much more infectious. We know there have been cases in New York, Colorado, Florida. I think one of the states that I just saw last night. I think it's a matter of time. Well, we probably may already have cases here in Missouri. We just haven't detected them now. This could throw cold water on our efforts to reopen in a couple of months and to contain what we already have. You mentioned we're at 15% positivity, which is still a high rate, given the benchmark of being 5% or below. And so, what assurances can you give to the public that we're prepared to not only deal with this current strain that we have, but to prepare for this new variant, which could indeed be devastating? Are we in a position to act to provide that type of assurance?
Yes, I think, when we talk about COVID-19, I think there's a lot of focus on just the disease itself, but we really have to focus on how it's transmitted. So whether it's the initial strain that was detected, or if it's this new strain that has the G614 mutation, like we really have to focus on how it's spread. And so we know it's spread by respiratory transmission, meaning that individuals, the respiratory droplets that are suspended in the air, et cetera. And so the measures that we currently have in place are necessary not only to slow the spread of the initial variant, but also this new variant that has been detected. The biggest challenge with the new variant, again, to your point, it's not so much that it's more virulent, but it's spread more efficiently. Because of the way that the proteins bind. So it binds more efficiently, meaning that which allows it to spread and cause disease more efficiently. And so, but the way we prevent that from happening is by wearing face coverings, by social distancing, by staying home if you're ill, practicing good hygiene. Those simple measures we know are effective. The science shows that. And so we can't forget the science that has been shown to us time and time again about how to slow the spread of illnesses that are spread by respiratory transmission. So we have to adhere to that, but we also have to be mindful of so that we don't cause unnecessary anxiety amongst the population regarding what's happening not only locally but also across the country. And so by providing a platform or maintaining a platform that provides accurate information to the community, and also using our other outlets to engage the community and inform community in a timely manner, we'll be able to not only bring, as the mayor oftentimes says, bring the community along with us, but we'll also be able to empower them along the way, so they're able to stay abreast of what's happening and what they need to do to protect their health and the health of the community.
Great, thanks.
I think one of the questions that also came up was whether or not the vaccines that are currently available are effective in providing some protection against the new strain that has been published. And so there's a couple articles in the New England Journal of Medicine that have looked at that. Although the data is very limited, what the current evidence shows us is that the currently approved vaccines do provide some protection against the new strain that has been detected. And so there's still a lot of studying that has to be done, a lot of research that has to be done to provide the medical and public health community with additional information. But based on what's been provided to date, that there is evidence that the currently approved vaccine, meaning those that have been the vaccine provided by Pfizer and Moderna, do provide protection against the new strain.
Thank you, Dr. Eccles. I just have one quick, well, perhaps not quick question, just from some community members and colleagues that I work with in the community. I know that we're not anywhere near rolling out the vaccine to the general community. However, there have just been questions about what are the plans and strategies to reach vulnerable populations.
Yeah, so we'll be working, so we won't be doing this in a silo. So I think that's kind of been our practice from the beginning, was to engage the system in this work. And so our emergency preparedness program is already communicating with other organizations and other agencies that have vulnerable population that may be either homebound or not able to come out to some of the brick and mortar facilities where the vaccine has been offered. And so we will make sure that there are plans in place to make sure that those individuals can also get access to the COVID-19 vaccine. Again, because we want to make sure that everyone, especially our vulnerable populations, are able to get vaccinated.
Thank you. Any other discussion around schools or vaccination? Okay, so our next agenda item is again Dr. Eccles, and it's the prioritization of the coronavirus relief funds.
And so similar to what we did in for the guess we'll call CARES Act 1 funds, we engaged the community. So we had discussions with a lot of our partners, but we also collaborated with other City of St. Louis government agencies to make sure that we were prioritizing the funds appropriately. Again, our goal is to make sure that we are getting resources to those populations that need them. So making sure that our most vulnerable populations are at the top of our list. And so that practice will not change. And so internally within the health department, we've already started having discussions about what the priorities are so that we can have those already outlined when the funding is available, so we don't have to wait after the funding is available to try to determine what the priorities need to be. And so we've already started having those discussions. We're also going to be engaging our community partners to see if there are things that they may be aware of that we aren't, that we need to add to our prioritization list. And so we're hoping within the next 10 to 15 business days that we'll be able to finalize our prioritization list so that it's in queue and ready to go when the funding is available.
Thank you, Dr. Eccles. Any questions, comments, discussion about prioritization of funds? All right.
So question, Rick, sorry. Fred, where are we in terms of the time frame for distribution of funds? Are we're within guidelines, federal guidelines for fund use? Have we come up against any time constraints?
No, not at this point. So we did the initial funding for CARES Act 1, the CARES Act 1 funds, as we call them, was December 31st, 2020. And so the health department, in collaboration with the mayor's office and other city agencies, we worked really diligently to spend down all those CARES funds. And then, because there was a deadline. But then towards the end of December, they extended the deadline to December 31st, 2021. However, the majority of our funds have already been spent because we did a really good job of getting the funds into the community. And so right now we're able to bridge some of the funding. So for example, for utility assistance, we did allocate, I believe it's 1.5 million of CARES Act funding, but that ran out. And so we're actually able to bridge that funding using community development block grant funds, which is from HUD, to cover utility assistance requests that we receive now. That's not the case for all the priorities. So most of the priorities we're able to address in a decent way, but this one we knew was going to be ongoing, so we made sure that was a bridge there. The other way we used the community development block grant funds from HUD was also to make sure that we were able to keep those disease investigators that we hired last year. We wanted to keep them on board through 2022, and so we're using the funds to keep them on board as well. So we're able to leverage funds where we could, but there are some priorities where the funding did run out, and so we're going to be waiting for the CARES Act 2 funds, or the coronavirus relief funds, to be received. We don't have a timeline, at least I don't have a timeline right now of when those funds will be released by the federal government into the states, but we are in having close communication with, close and timely communication with our federal partners, or our partners in DC, as well as at the state level, to make sure that we are able to share that timeline with you all when it becomes available.
Thank you. Any other questions, comments? All right. Looks like Dr. Eccles is a majority of the agenda today, so you have a couple more agenda items. The CDC grant for community approaches to reducing STIs.
Right, so in the fall of 2020, yes, the health department received a grant from the Centers for Disease Control for community approaches to reducing sexually transmitted infections. And so where we are at this point is, had to execute submit a board bill to that had to be routed through the legislative process in the city of St. Louis before we could actually receive the funds. And so we're at the end of that process at this point. And so we are looking to execute contracts before the end of this month. However, the work has already started. The leads for this project have already started engaging some of our community partners. So they've been going out and educating and informing our other partners about this work that's being done. So if there's opportunities for them to support this work, they'll be able to do so. But overall, we want to make sure the community or the St. Louis region is aware of the work that's being done, because the work that the outcomes of this project aren't just limited to the city of St. Louis. They will expand into other jurisdictions across the state. And so we want to make sure that other members of public health stakeholders are also engaged and aware of the work that is being done. We have regular standing meetings with our project office with the CDC. I think our next one is today, actually. And so that's been going extremely well. We actually had a orientation meeting where we were able to hear about some of the work that's being done in other jurisdictions across the nation. It's really exciting work, and the health department, we're excited to be a part of this very small group. Now, only 4 sites in the United States were selected, and so we are I want to say we're hanging out with the creme de la creme of STI reduction, but we're really working with some organizations and individuals that are implementing some very innovative and thought-provoking projects across the nation. And we're excited about having the opportunity not only to learn from them, but to partner with them and also share our story so that they may learn from the work that we're doing here in the city of St. Louis.
Thank you, Dr. Eccles.
One quick question about the partnership for that. First of all, this is just wonderful news. We spoke before about this. Congratulations to Dr. Eccles and the staff for securing this grant. In terms of the partners, can you give us a little bit more specific information about the partners? We a while back created this organization, Think Health, the collaboration between the city and the county departments of health and other entities at the med schools, WashU and SLU. That would seem to be really an appropriate organization for really assisting in the execution of this grant.
Yeah, so in the proposal, we outlined which organizations would be supporting the work through the contractual basis. And so Williams and Associates, because the focus is Black men who have sex with men, they're leading the efforts in the community, but we're also adding additional components such as cultural humility and cultural sensitivity. And a lot of that work will be provided by Washington University staff. And so such as Veta Sanders Thompson and a few others, and that will be providing trainings for the community advisory board that's developed as part of this project.
Great, thanks.
Thank you. Again, definitely congratulations on securing that funding. Quick question. What have the STI rates in terms of trends look like given COVID? I mean, has COVID and the ability to access preventive care and STI testing, has that affected the rates? Is there anything that we need to be concerned about in terms of COVID's effect on STI prevention?
Yeah, so early on, especially during the pandemic, a lot of people were not seeking medical care because some physicians' offices were actually closed and they weren't seeing individuals because of COVID. And so preventive care, I think it dwindled a little bit, but I think as over time, those agencies have actually resumed some of their services. So we're hoping that will pick up over the upcoming months as well. A lot of the organizations actually moved to appointment-only services, and so we're following that extremely closely as well. But yeah, there was, at least early on in the pandemic, there were challenges with individuals being able to access preventive care because of COVID-19. But as things have evolved, more services are accessible because of different measures that the providers have implemented.
Dr. Eccles, does the STI programs that you've been talking about include testing and treatment of HIV/AIDS? Is that part of it?
Yes.
Okay, thank you.
And so we're also working closely with our Ryan White partner. So as you all know, the health department oversees Ryan White Part A. And so we've been working really closely with all of our subrecipients as well as the Ryan White Planning Council to make sure there's proper information sharing about the availability of resources and services across the, not only across the city of St. Louis, but across the St. Louis Transitional Grant Area, which covers 7 jurisdictions in Missouri and 5 jurisdictions in Illinois. So there's been communication also with our partners in Illinois about service availability.
Thank you.
Any other questions about the STI grant? Thank you. And Dr. Eccles, accreditation updates?
Yes, so our previous submission was, I want to say March of 2020. And we received really good feedback, strong feedback from our FAB project officer or project evaluator. And so everything is moving forward really smoothly right now. The application for our next submission is due in March. And so we've already started looking at the documentation that will be needed for us to submit. And so I'll be working with, actually we're hiring a new staff. She'll be starting on the 19th of January. Her name is Julia Hughes. And she'll be working really closely with myself and Amanda Holmes, who's one of our public health educators, to complete the documentation that's needed for the our submission this year. So it's an annual submission, which is essentially an update on the activities that the health department have conducted to make sure we're complying with what is outlined in our strategic plan. And I believe I shared the strategic plan with all of the Board of Health and Hospitals members earlier this week. So I hope that you all will take time to review that, as we'd like for you all to be involved. I think everyone in some capacity has something to contribute to the health department's activities as it relates to fulfilling the plan that is outlined in that strategic plan.
Thank you, Dr. Eccles. Any questions, comments, discussion about the FAB accreditation? Wonderful, thank you. So our next agenda item is new business. I actually do not believe there's any new business. I know there was some concern over the past month that after the holiday winter break, there would be a surge in COVID cases that we are currently not seeing as of yet. So any movement towards new policies or adapting our current measures for COVID, it seems like we can stay the course at this point because we are not seeing a surge, and hopefully we won't. Is there any other comments or business or anything that needs to be addressed? If not, we can move on to committee reports.
I think the only other new business, which is, I guess, I want to say semi-new business, would be orientation for board members. So we're working together to provide orientation for board members. So the first phase of the orientation will be the health department providing each board member, all the board members, an overview of what we do. We think it's really important that the Board of Health and Hospitals members be aware of all of the different programs that are operating within the health department. Also, we want to make sure that you all are aware of our legislative mandates for certain programs and public health activities, as well as those core public health functions that we're responsible for implementing and carrying out to protect the health of the community. And so that'll be part one. And then part two of the orientation will entail an in-depth discussion about the legislative requirements for the Board of Health and Hospitals, as well as an overview of the relationship between the Board of Health and the appointing authority for the Department of Health, and opportunities for, I guess, leveraging resources and expertise, which will be included in a packet that we'll be sending out to each board member. This packet was developed by the Missouri Department of Health and Senior Services in late 2019 or early 2020. They actually came to the health department and provided a small orientation for a few board members. And so we'll be using that packet to kind of set the foundation for the board members, especially new board members who may not be familiar with some of the nuances associated with being an advisory board for Department of Health.
Thank you, Dr. Eccles. And the tentative date for that was January 27th. So we can discuss any updates or any additional details and make sure everybody has their packet, because we will have another board meeting before the 27th of January. So any questions about the board orientation? And thank you, Dr. Eccles and team, for putting that together. I think it'll be helpful and a great start to the to 2021 to make sure everybody is on the same page and that we are can all have information so that we can best support the Department of Health. Okay, so if we don't have any other questions about board member orientation or any other new business, we can move on to committee reports. Is there a report from the Governance and Nominating Committee? Is there any new business? I saw Dr. Lee.
No, we have not had a meeting since then. I don't think there's any. I don't think there's anything that we need to work on. That's what it is. So we did not meet, and we did not have any report to address this time.
Great, thank you.
I would comment that, based on the recommendations of the Nominating Governance Committee, we have the new board members, and we have Dr. Luis Juifra here. I think this is his first board meeting official, and so I think it's probably good to just say, see if Dr. Juifra can have a couple of comments about being here.
Yes, it's my pleasure to be here. As you corrected me, I cannot replace Chris Swindle, but he's irreplaceable, but I'm gonna try my best. I'm eagerly waiting for the first orientation meeting so I can learn the ins and outs of the board and try to be of as much help as I can. So thank you everybody for allowing me to participate.
Thank you. We welcome to the board, and we're very happy to have you, and we're looking forward to working with you. And we know that we've been talking about COVID and all the effects of COVID and how it affects mental health, so we welcome your expertise in mental and behavioral health, and that'll be important as we move forward to try to push through and recover from the pandemic. The mental health of our community we have to take care of the mental health as well as the physical health. So thank you for bringing that expertise to the board. And as Dr. Ross said, the governance committee was quite busy over the past few months, identifying new board members and vetting new board members. And so thank you for that work that was done. So the Academic Public Health Collaborations Committee, any updates?
Madam Chair, I know that there are no updates, but I would charge the committee in this new year to really speak more about the partnership with the St. Louis County, and really continue to focus on the shared services model that we discussed in the past. It's so important that we move in tandem, particularly with the challenges we're going to continue to have. And so I mentioned the Think Health initiative to Dr. Eccles, which really is a collaboration with the academic medical centers and the health departments. So between that initiative and really looking at our shared services, I'm hoping that the Academic Collaborations Committee can focus on that, as well as working on engaging University of Missouri St. Louis and their expertise. I think that we underutilize that particular revered institution, and I'd love to see us bring in some expertise from University of Missouri St. Louis to the health department.
Thank you, Dr. Ross. Yes, this is the health of citizens is definitely an all hands on deck situation. So I know that Dr. Eccles and Dr. Mcbride and Dr. Ross and I spoke about making sure that when we talk about academic and public health collaborations in an academic health department, that it does include all of the academic institutions, given that the different institutions serve different audiences, and it can only serve to make the health department stronger and to better serve the people in the community. So yes, I agree. Moving forward, we definitely need to bring in some folks from UMSL and just create a transparent and united front and between the academic institutions and the city and the county health departments. Any comments, Dr. Mcbride?
Yeah, I think I just want to echo Dr. Ross's comments, and we have a lot of new members of the board, and I would encourage them to think about this issue as well. And I know Will has been thinking for a long time about, as we talk about, infectious disease does not respect to Skinker Boulevard. So, so the whole county city issue is relevant here, but also this academic issue is relevant, and we're in the middle of a century, an unprecedented pandemic that we haven't seen in a century, and that has shown us that we have really unprecedented challenges to our public health systems at the city, at the county, at the state, and I think we've risen up quite well in our region. I'm pretty proud of what our city and our county have done, especially relative to the state. Sorry if they're listening, but I think we've shown pretty well relative to the state. So I would encourage us, eventually we're going to get through this by the end of the year, I hope. And I would encourage us to not only to think about the lessons we've learned in this pandemic about relationships that have been built between the academic institutions, between the large hospital systems with the pandemic task force, the kind of relationships Dr. Eccles has built through the pandemic, and those academic relationships, and the kind of things we can build, infrastructure, IT, dashboards, epidemiology. So let's just not go back to where we were before the pandemic started. And so to use these tools to tackle other public health challenges like STIs and other things. And this won't be the last pandemic we're going to see. So I would just encourage that sort of thinking in the new board members to think about that. And we should be pulling in UMSL and their mental health expertise, their nursing expertise, their social work department and others, and other institutions too. So that's just my comment.
Definitely, because even though we've had the tragedy of COVID, we had existing tragedies related to health equity issues and chronic disease and communicable disease that have been a burden on the city, and a disproportionate burden on some of our communities that predated COVID, continue through COVID, and will be around after COVID. So all of this infrastructure and the relationships that we've built, I mean, we need to continue to extend them and deepen them to address the inequities and the issues that predated COVID, and also to make sure that we're prepared for another pandemic if, as we expect them to come in the future, unfortunately. But we have to maintain these relationships and deepen the relationships, because there were issues that needed to be tackled even prior to COVID. So thank you, everyone, for your comments. And we'll make sure that we continue to report out on building those relationships between the city, the county, and the different academic institutions to to strengthen and support the health of our community. One last committee report, if it is anybody available from the Health Communications Committee. I know that some folks had to jump off the call. Is there anyone from the Health Communications Committee that's available or any updates?
Dr. Eccles, do you want Daniela to give a review of where we are in communications as our agency, or we don't have enough time for a full board summary, I don't think.
Right, there's a lot of work being done. If Danielle, if you had the Cliff Note version of updates, that'll be great.
Sure. Good morning, everybody. I will make this as succinct as I can. We are in the process of launching and have partially launched a respiratory illness campaign under the Be Well initiative, which is so let me just preface and start. I'm with Elasticity. We are the agency that is working with the Department of Health for communication needs. So we launched in the summer, we launched a new brand sort of campaign, overall brand awareness campaign called Be Well. We have used that same tagline for respiratory illness, which is basically we're focusing and we're trying to be in alignment with the county as well and the Regional Response Task Force on the same messaging, but focusing on the 3 W's. And so we've launched a radio campaign already. Soon you will see an updated version of the Be Well ads, Be Well, Be Safe, with folks wearing masks and pushing the 3 W's. We're also going to have some what we call OTT ads, but those are just ads over if you have like cable, they're in there, they're on Bounce TV, as well as more digital ads. So that's where we're at with that. And like I said, as I mentioned, some of that you'll probably have heard some on the radio and heard Dr. Eccles, and you will see more updated campaign and ad materials with that focus as well. And we did meet with Serena probably a couple months ago now, with the first sort of comms regional response team meeting. And it's definitely, I've been, in communication, obviously with Kim and Harold and Lisa, and it's our priority as well to try and align our messaging and our work and our efforts with what's happening within the region. So we're continuing to do that. We are committed to doing that. And we will keep on doing what we can, because I know that we all share the same goal as far as respiratory illness and keeping people safe.
Thank you. Thank you for the update, Danielle. I see a question in the chat that says, did these marketing efforts leverage or connect to Prepare STL?
So we're working on that. As I mentioned, the Regional Response Task Force has been working with Prepare STL. So right now, what we're trying to do is make sure that our efforts coordinate. So one of the things that we found was that Prepare STL has already translated things in multiple languages. So, working with the different teams to see how we can leverage or support that, and coordinating what we call like media buys. So, if we know that we're doing, say that the city is putting a lot of money in one area or one vehicle, how can we complement what else is happening in the region? So that has been our approach. And I think that will probably continue to be our approach, is to not compete, but complement the other efforts in the region.
Thank you. I have a quick question about, will you move towards communication efforts in terms of the vaccine rollout when it becomes available to the general population? Do you have plans for that as well?
Yes. So we're obviously working with the team because we won't put out anything until we're ready. But part of what we decided in the approach to be well and be safe is that it is a flexible enough message, and it's a flexible enough campaign that it will be recognizable, but that we can still adapt it to whenever the vaccine is available. And we can shift the ads and placements to reflect those changes in our goal.
Thank you. Any other questions about communication or any updates? All right, thank you, Daniela, much appreciated.
Thank you.
All right, that was our last board committee report. And our next agenda item is departmental updates. Dr. Eccles, do you have any updates or anything else that wasn't mentioned in your other reports?
The only other thing is we have some legislation that's being reviewed for, or to be introduced this Friday, I believe, for our food code. So we're updating our food code. I sent out the draft language to all the board members. So Janine Araghi and her team did an amazing job pulling everything together to make sure that we're aligning our efforts and our restrictions with those that have been established by the FDA. And so we want to make sure we're complying with national standards, and this puts us much closer to that. And so that will be introduced to the Board of Aldermen on this Friday. So we're really excited about that. Janine, if she has anything to add, she can chime in.
Thank you. I just want to make sure everyone knows that we we did review the St. Louis County's work that they've done in St. Louis County Public Health Department for their code revision. And we worked with a number of people in the community over the last couple of years to develop the new code. And I'm really thankful for the team because they did an outstanding job. And especially we had a practicum student from the Brown School, Dr. William Effa, who was the coordinator during his practicum. He's a medical doctor and working on his MPH. And he did a great job with us. So my thanks to all the team. And appreciate any comments or questions the board may have. You can email me. Thank you.
Thank you. Thank you for your work on that, and congratulations. Any comments or questions?
Yes. Yes. Yeah, I have a question toward Dr. Eccles regarding the changes with the food code. Is there any? I mean, I read over those documents you sent over, Dr. Eccles, and there are quite a lot. Is there any? Can you just mention of just a few items that is going to be updated that is not in the old food code? So we, I know there's a lot in there.
Yeah, I don't have the summary in front of me, but maybe during the next meeting, we can, as part of the legislative update, we can go over the summary of the changes that'll be implemented with the new food code. And I also sent out the summary to the group as well, if that's okay with everyone.
Perfect. Thank you.
Just in the interest of time, I just want to make sure.
Thank you. We can make sure that we mention that on the next agenda. So
we have just one more thing for the health department. So we do have additional legislation that's being finalized. So we had this health department also received funding from the CDC Foundation, which is a separate arm. It's not the CDC, but it's a kind of their philanthropic arm. And so we received $200,000 from the CDC Foundation to do some work with communities of faith. And so we will be developing care packages that will have faith-based messaging. So we're working with our clergy advisory board to develop the faith-based messaging. And we're hoping to have that finalized over the next couple of weeks. So I'm working with Dr. Kanika Turner, Lisa Potts, and the clergy advisory board to move that forward. This is really exciting because the CDC and other national organizations have not developed COVID-19 prevention messaging that are faith-based. And so the CDC Foundation and the CDC are excited about this work, and so they'll be using the results of this work to share on a national scale. And so we're really excited about being able to do this for not only the city of St. Louis, but for the nation. And that's all I have.
I have just a quick question about that. Is it going to be, will there be a diversity of faiths represented?
Yeah, so we have Christian, Muslim, Buddhist. There's roughly 7 or 8 different faith-based groups that are represented on the clergy advisory board, and so all of them will be contributing to the messaging that is created. Because we want to make sure that whatever message is created is that it's applicable for all, at least the majority of faith-based organizations.
And are they going to, will that also include ways to disseminate to their congregants or to the community as well, dissemination of the message?
Yes, so we'll be assembling at least 10,000 care packages, and so all those will be distributed to the faith-based organizations, and then they'll distribute it to their patrons, which include maybe their parishioners as well as individuals that may live around the area where their organization is planted. And included in the package will be just COVID, essentially a COVID care package. So you have a thermometer, hand sanitizer, a few face coverings, information about how to properly wear a face covering, as well as the faith-based messaging that's going to be developed by the board.
Wonderful. Congratulations on securing that funding as well. Thank you very much.
That's a way that we can, excuse me for interrupting, but that's a way we can get positive news out of Missouri, positive, constructive, bring people together news, which I think we badly need for our city and state. So thank you, Dr. Eccles and your team, for getting that grant. I think that's cool.
Hopefully there's as Lisa said, there's definitely the benefit in getting COVID messaging and helping with COVID prevention, but also in some opportunities just to show unity and diversity, and that hopefully we can get some press on that positive message that coming together across diverse faiths and sure ethnicities and cultures to get together to tackle COVID. I agree. I think it's great. So hopefully the messaging can go just beyond the COVID aspect of that to bring some messages of unity. And thank you for posting. So in the chat, Kimberly has posted the clergy advisory board information if you would like to look at that. All right. Any other comments or questions? Some great work and happenings that are going on at the health department. Lots of outstanding work. Thank you, Dr. Eccles and team. Any other updates?
I see the mayor has raised her hand.
Oh, Mayor Cruson.
Good morning, all.
Good morning.
I just really wanted to number one, thank Dr. Ross for his many years of leadership as the chairman of the Board of Health and Hospitals. He's certainly done a great job, and of course, he's not going anywhere, so we'll continue to rely on him. I wanted to welcome you as the new chair. Thank you for taking that on, and really just welcome the other new members to the board. It's a very important advisory board, and I know that you all spend a lot of time doing this, and I just want to say that I think it's a great relationship, and it's been very helpful to us, particularly over this past year, and before that too. But as you know, I was not as involved in prior to COVID, but I think that the work that you all have done and the support that and advice that you give to Dr. Eccles and to the community has been very valuable. So I just want to thank you for that.
Thank you for your comments, Mayor Cruson, and thank you for attending and for all the support that you give the board and your dedication to helping with the public health of the community. Thank you for all of your work, and thank you for attending and for the great comments and for your leadership. Thank you very much. Any other comments or questions or updates? That's Dr. Eccles gave a lot of updates, a lot of work. So congratulations again. And we're certainly here to support you on all of those really outstanding new initiatives. So 2 more agenda items left. Old business. I don't think that we have any old lingering business. However, given that we are still in a pandemic, we will continue to meet every other week as opposed to our every other month. And so our next meeting will be on the 21st, same time, same place, 8 a.m. on Zoom until further notice. So 8 a.m. on January 21st, and we will be getting announcements you'll be getting information and updates about with the Zoom link and the information for our next meeting. Are there any announcements from anybody in attendance?
Craig had placed a note about the presentation Dr. Fauci is giving at Washington University. He actually spoke here at 8 a.m. And I think he said something about that's going to be posted on the website. Can you clarify?
Yes, doctor, I put that. There's the connection there. It's going to be on the Grand Rounds website for Washington University.
Okay. But not the health department's website.
That's correct. I guess we could ask Kim and Harold whether we would also make that connection, but it's already going to be posted.
Okay.
Thank you, Craig. That would be great if you said it'll be posted within 24 hours so everybody can watch Dr. Fauci's comments. That would be great. So if there are any other announcements or comments, encouraging words, anything else that anybody would like to say? So I'd like to say thank you for everybody for attending and supporting the board and supporting the mental, physical, spiritual, and emotional well-being of our community. I know we've been meeting a lot, and we'll continue to do so to make sure that we can push through this pandemic the best we can.
Dr. Ballou, I just have one really quick announcement.
Sure.
The regional response team is hosting a question and answer panel next week on the COVID vaccine, and we'll have panelists to answer questions. We've already started collecting questions from community. We're doing this in partnership with Prepare STL. So the earlier question about kind of when the city health department will start talking about vaccines, it's actually through this partnership with the regional response team, Prepare STL. The first panel will be on the 14th. So that's next Thursday at 3 p.m. And I can send that information out to the group in case folks want to attend or help promote it. We have about 200 people registered so far, and we're expecting that to double by next week.
Thank you. If you could send that information out. I know that, as I said, I've been talking to a number of community members and local community activists that are really interested in making sure that the community members get the vaccination. And so if you could send that out to us, that would be great. So we can spread the word and attend. Thank you.
Mm-hmm.
Any other comments? All right, if we don't have any other comments, I will move that we adjourn our first meeting for 2021. And
Second.
to second that motion. Move for adjournment.
Aye.
Aye.
You.
Aye.
All right, so we are officially adjourned, and thank you, everyone. I will see you on the 21st. And if there's any questions or comments, feel free to reach out. And again, thank you, Dr. Eccles and Dr. Ross and Dr. Mcbride. Thank you, everybody on the call, for all of your work. And stay safe and have a healthy, productive couple of weeks until January 21st. Thank you.
Bye.